So basically now going towards the differential diagnosis, when you see a ulcer on the lateral side of the tongue, so the first is like to consider it a traumatic ulcer, tuberculous ulcer, or either you consider it as a leukoplakia due to white patch. Erythroplakia means it can be red, white, and pyogenic granuloma means it is a mass. Non-Hodgkin lymphoma, malignant granuloma, necrotizing ciliometaplasia. Then you have aptis ulcer and then syphilitic ulcer. Okay, now moving towards a very important topic, which is epithelial dysplasia. There are some points you should remember it that what happens. Now there is number one, cellular atypia. So basically when there is atypia, it is changes on the cell level, but when it is changes on the tissue level, we consider it dysplasia. Okay, so number one, cellular atypia means there is some changes in the cell is present. Basically nuclear hyperchromatism or pleomorphism. Nuclear hypochromatism means there is now dark nucleus, and pleomorphism means there is different types of shapes of the cells which is present. Okay, abnormal mitosis, especially in prickle cell layer, means there is an abnormal mitosis means increased number of cells in prickle cell layer. Okay, your NC ratio is now increased. Very important. Loss of polarity of basal cells with a dropped shaped of ratty peaks means there is a drop shape now of ratty peaks. Loss of differentiation between the basal prickle cell and also of deep cell keratosis. Okay. Epithelial hyperplasia means increased number of cells, or either there is an atrophy with a diminished intracellular adhesion, means the intercellular connections or bridges which was present between the cell, now it is diminished. Prominent large nucleoli now present, and abnormal keratinization is now present. So it is very important you should know the epithelial dysplasia. Okay, so number one, repeat with me, cellular atypia. Okay, now there's the nuclear pleomorphism and hyperchromatism also. Now there is basically abnormal mitosis in the prickle cell layer. Okay, your NC ratio is now increased, and now you have the loss of polarity of the basal cells and with a drop shaped ratty peaks. Now loss of differentiated between the basal and prickle cell and also deep cell keratosis. Now you have epithelial hyperplasia or atrophy with the diminished intracellular adhesion and prominent large nucleoli, which is very important. Now abnormal keratinization is also present, abnormal. Okay, so this is. Now, treatment modalities. Number one, surgery, radiograph, chemo, laser or immunotherapy, gene therapy, or only surgery or radio, which is are curative. So, why we do surgery? Why we do radio or chemo? Why sometimes we just do surgery? We will discuss now one by one the different treatment modalities.